It's up to you. It's up to all of us to keep each other safe and healthy as Omicron rages on. Joining us with a big campaign backed by the Ad Council is Dr. Gerald Harmon, president of the American Medical Association. Doctor, thank you so much for being with us.
Thanks for allowing me to join you.
First question is, when is this surge going to end?
Boy, that's the question on the tips of everybody's lips. When is it going to end? Because it seems like it's been forever. I remind myself and all of us, it's only 24 months, but you're looking at 24 COVID months, and they seem like dog years. You know, they won't go away. I really hope it will end. I think what we're going to have to continue to do is take our advice that we've had for several months now. We need to take the best precaution we can to protect us from the current variant and future variants. So get vaccinated. Public health measures are important. Got questions about it, talk to doctors like me and your own doctor. Get advice, get your questions answered about vaccination, and get vaccinated.
Absolutely. With my own social circle and friends of friends, it's just one report after another of someone coming down with the Omicron variant, despite the fact that they have been vaccinated and boosted. So for people to really understand how transmissible this particular variant is, that's important.
Layla, you're right. It's a highly transmissible, highly contagious variant. It's probably at least 3 times more contagious than the previous variants. And that really tells us that you got to take all protections. We do see what we call vaccine breakthroughs, where you've got under-vaccinated people that maybe only gotten 1 or of the vaccine doses of the 2-shot vaccine variety, or maybe are eligible for a booster and haven't been boosted yet. We do know that those folks do get vaccine breakthroughs. Where you get an infection, you tend to get very mild infections. You're not transmissible for very long. You're not sick for very long. And you don't get sick enough to go to the hospital to wind up being in the ICU or dying. So it's a very good protection to take right now, step to take. Also know that if you get your children vaccinated, and remember, those that are 5 and up are eligible, get those children vaccinated too. They're going to be out there. They're going to transmit it to their colleagues, to your families. Try to get them as completely vaccinated as you can as well.
Yes, and just to throw some numbers out there, 500,000 Americans are being diagnosed with Omicron every single day. So hence the Ad Council's campaign to ensure that people understand how important it is to get the vaccination. Let's talk about the kiddos for just a second, if we could, Doctor. So for a lot of parents, they're a little worried about getting their children vaccinated. At this point in time, has it proven to be pretty safe? And what is the youngest age in which a child should be vaccinated?
Good point. And I mentioned that these are FDA-approved vaccines for children 5 and up. The boosters for ages 12 and up. And we encourage, in addition to the vaccines for those children, that when they go to school, they wear a mask, and they wear a medical-grade mask. Those are all public health contingencies you should enact when we have a high transmissible virus rate, like we do in South Carolina. 16,000 new cases every day, now setting records here in our state, as well as increased number and record numbers of children becoming infected. So it's very important. When your age is 2 and up, you can wear a mask, and age 5 and up, you get the vaccine. The FDA is working on the vaccines for the age 2 and up to go along with other childhood vaccines as well.
Okay, what do you say to parents who are upset at the idea of children having to wear masks? Because that is a big thing. It's in the news all the time. A lot of parents, they're just upset that their children are going to school, having to cover their faces. They can't see expressions on everybody else's face. So what would you say to them?
That's a very good question, because my grandchildren are having to do it. I've got 8 of them. One is below 1, but the other 7 are all in public school, and so they deal with that all the time. And my kids are not medical professionals, but my wife is a recovering school nurse. We're pretty good about getting our grandkids wearing a mask, and they're very accommodating. I don't think any of us are really surprised at how quickly the children, as young as 2 or 3, certainly the 5-year-olds, will wear a mask. They put it on as part of the superhero costume. They don't seem to mind it. I know it's becoming almost a standard for them to do it. So it is protective as well. It doesn't guarantee, but it minimizes the chance of transmission. It's okay to ask them to wear a mask. It's not unreasonable. To your question about vaccine hesitancy for some of our children and our parents being concerned, you know, it's fascinating to me that a lot of the parents have gotten the vaccine, but they're somewhat a little hesitant to bring their school-age children into the vaccination program. And I think that they're being reasonably hesitant. I'm not trying to accuse them of, and one of the conversations I have with my patients when they say, Dr. Harmon, I'm concerned about it, I try to answer their questions, not to judge them. politically or demographically or intellectually. It's okay to have questions, but you need to do things like we're doing with the Ad Council, the AMA, and my personal life, is answer the questions one at a time. It's important to answer them and reassure them that this is a safe, effective way to take care of this virus and the pandemic.
Absolutely, because according to a doctor that we spoke to and other experts last week, we've been hearing that there could be another variant, and we just need to be as proactive as possible. I would also like to point out that Dr. Harmon, you became the 176th president of the association. Congratulations on that, but we're also proud to say that you are a doctor right here in South Carolina in Pawleys Island. I want to thank you so much for joining us.
Leda, thank you so much for being part of the solution, being on the side of science. WTAT and your listeners, thank you very much. Look forward to getting on the other side of this pandemic.
Thank you, Doctor. So do we. We're back after this.
Okay.